Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, it's a race against time to kill mosquitoes that carry the Zika virus, which is linked to severe birth defects. All Zika cases in the U.S. so far have been in people who traveled from Latin America, but health officials expect mosquito-borne infections will occur here soon. John, there is a big battle in Washington, as we've talked about before, about funding to fight Zika. Where do things stand right now?
Well, there's still no money that's been allocated, and I spoke to Tom Frieden, who's the head of the CDC, and he told me it's mind-boggling. This is no way to fight an epidemic. We're basically nickeling and diming the response when we know there are urgent needs that aren't getting met. Now, the latest CDC numbers show there are hundreds of women who are pregnant and have Zika infection. The ones that are in the United States, there's no evidence, as you point out, that they got it from a mosquito in the United States that was infected with Zika. These are felt to be travel-related. But what the public health officials I'm talking to are saying is, look, we've had all winter to think about this, to prepare for this. This is like watching an accident happening in slow motion. We don't know how big the accident's going to happen, but it's going to be. But do we really have to wait for the first case of mosquito that's infected with Zika being in the United States, then turning around and biting somebody who's uninfected? Now you've got local transmission. Do we really have to wait for that before we go into high gear and give public health officials the funds that they're saying they so desperately need?
So, Holly, what would the funding help do?
Sure. So there are three main areas where funds are urgently needed, although even more than that. But that probably first and foremost would be for vaccine development. Regardless of whatever epidemic we're fighting, if it involves infectious disease, getting vaccines out, protecting the community, that's really the foundation of how we fight it best. And we know that to encourage researchers to focus on it and prioritize it, that takes funding. The second area really has to do with making testing for Zika faster, more accurate, and more widely available. If that one mosquito in the U.S. contracts the Zika virus and is able to pass it on, we're going to want to be able to test people immediately and get them results immediately, especially men and women who may be trying to have babies. And then finally, just about controlling the local mosquito population. If there are mosquitoes carrying Zika, small communities need to be able to respond immediately. They need to be able to spray, get rid of water that's standing around, and educate the community of how to protect themselves.
Well, moving on, more than 15,000 Americans suffer a spinal cord injury every year, but one treatment is offering new hope for patients and their families. Here is John with more.
There's nothing we could have done to change that night.
On April 9th, 2013, James Mason was an accident waiting to happen. He had been drinking, and his stepfather, Bob Gambuti, tried to stop him from driving.
He grabbed onto me, I grabbed onto him. He pulled my leg out, and we fell back, and his neck broke.
I remember just hitting the ground. I remember the whole way with the stretcher.
The most devastating part of the whole process was the first day that they lifted him out of a bed, and nothing moved, just his head. That really hit hard. At that point, I really wanted to go jump off a bridge.
Mason was left a quadriplegic with just the slightest ability to move his arms. Doctors said he'd never walk again. Gambuti, a retired cop, became his full-time caregiver and found an experimental trial at New York's Mount Sinai Hospital.
We'll take good care of you.
We spoke with Mason just before he underwent delicate neck surgery to try to repair the damaged portion of his spinal cord by injecting stem cells.
And what's going on in your head? What are you thinking? What are you hoping for?
I'm just super excited, ready to just get it done and go back to rehab and start proving the doctor wrong even more.
Okay, slow.
The surgery performed by Dr. Arthur Jenkins took 4 hours. Researchers have followed James and 5 other patients, all with severe spinal cord injuries.
Squeeze as hard as you can.
We met up 3 months after the surgery.
Notice any change?
Yeah, my wrist has gotten a lot stronger. I'm able to grasp around a lot of other things.
And after another 3 months?
I think it's almost doubled with how much I've gotten better, and the sensation back into my feet. I can feel pressure onto them throughout my legs, and they've noticed that I have a little bit of movement into my hips now.
The company sponsoring the trial reported 4 of the 6 patients experienced improvement in both muscle strength and function.
Try pulling the thumb towards me.
Dr. Jenkins, who is not affiliated with the company, has continued to monitor Mason.
My 2 cents is it worked, that this actually changed his neurologic recovery and function, that his actual functional improvement is from the stem cells that were injected.
Mason does not blame his stepfather for the accident. In fact, he's grateful.
If I'd gotten in my car, I could have killed someone else, someone's mother, someone's father, someone's child. And if I would have survived through that, I wouldn't be able to live with myself with that.
It's tough when people say, oh, I'm sorry. Don't be sorry. I still have him here.
Well,
I just spoke to Mason's dad, who feels that he's still getting stronger. Mason's still getting stronger in terms of his upper extremities, not moving his legs, but having a little more sensation there. And Mason absolutely believes that the stem cells have helped him in his recovery. Of course, it's impossible to know exactly what happened there. Were the stem cells responsible for rebuilding his neural connections? And so we're going to need to have a lot more study here before we can
really
say widespread. But it is an encouraging first
really encouraging to see.
Fire.
All right, finally, it's probably happened to many of you out there. While looking right at someone you know well, you call them the wrong name. It's called misnaming, and a new study found some patterns in how it occurs. Researchers at Duke University say these mixed-up names usually come from the same social categories. For example, you might call a good friend by another friend's name, or a family member by another family member's name. And get this, that can even include the family dog.
I so relate to this, but on an even more dramatic degree. You know, so I have 2 daughters and a dog, and it's not even that I just transpose their names. Sometimes I call them no name at all. It's just, you pick up your backpack, whoever you are. Just pick it. You know, I mean, it's unbelievable.
And it happens with dogs, they point out, but not with cats.
Why is that?
Well, they say cats kind of dogs kind of respond to their names.
Right.
And the cats are kind of more like, you know,
whatever.
Look at the paw,
Yeah.
you know, whatever. And so that's more likely. The dog's name is said more often.
Well, luckily I have your names to read. So Drs. Jon LaPook and Holly Phillips, thank you both so much.